Hi, I'm Matthew Schnipper with Side Dish, and this is a special podcast segment we're doing about Restaurant Roundup. It's a KRDO segment that started when they launched a show earlier this year where they take health department ratings from El Paso County Health Department, the restaurant ratings, and follow up on those. So I reached out to KRDO and asked if they would sit down with me and let me interview them about the segment. I sat down with their GM, station manager, and the reporter, and they were very forthcoming about the show. Hope you enjoy it. Give it a listen or a watch. It's just about 20 minutes. I'm Matthew Schnipper with Side Dish. I'm here in the KRDO studios today. I'm going to ask you each to introduce yourselves to us real quick.
Starting now?
Starting right now.
Right now. Steve Dorr, General Manager of KRDO TV and KRDO AM FM News Radio.
Julia Donovan, Restaurant Roundup reporter.
Stacy Lynn Onifree, News Director.
Thank you for having me here to do this interview. I reached out to you because I wanted to talk about Restaurant Roundup, and I think it's gotten a lot of traction in the community, so it's awesome to be here to discuss it with you. Just to jump right in, what was the inspiration behind creating the segment at the beginning of this year, and how did all that come together?
We just looked at it as a real opportunity to report on restaurants because no one else is really doing that. No other local TV station is taking a look at restaurants in our area. We've had discussions about sometimes the restaurant industry is a little underappreciated. So this is a way to spotlight the achievements and sort of the positives in that community, but also from a journalistic viewpoint, being the watchdog for our viewers and holding them accountable when they need to be.
What's your method for selecting the restaurants you want to do follow-ups with?
I can take that one. So we go through the routine health inspections, the recent ones, and we look at who has the highest scores, based on the number of violations, and who has the lowest scores.
Okay. And have any of you worked in the restaurant industry before?
I have.
You have?
We all have.
You all have?
Oh,
okay,
yeah.
Quick story. I mean, how long, where, what?
Through high school and college, I started as a busboy. Then they put me as what they call a garnicher, who made salads. And then I worked my way up to the line. I prefer the back of the house to the front of the house.
Oh, cool. Rare back of the house
Rare
guy.
back of the house guy, that's right.
I worked at Dunkin' Donuts back in Massachusetts. It's kind of a rite of passage there.
Yes, I did.
And I worked there for several years, in high school, through college, before I was able to get paid internships. And then just a couple years ago, I was a server up in the Denver area.
Okay.
Just high school and college, did some hostess stuff, but mainly server.
Okay. Have any of you taken the Serve Safe or any other food safety training in the past? Mm-hmm. You have too? Okay. Did you do that by way of background for this, or you just did that when you were working in the industry?
When I was a server, it was required by the restaurant.
Okay. And then, so do you liaise directly with El Paso County Health inspectors for any reason, or do you just work after their reports?
Anytime we need to follow up about an inspection, see if a place maybe was re-inspected, but it's not on the website yet, and sometimes it takes a little bit for that to get updated, I'll contact the public information people over at the county health department.
Okay, so just to be very clear, you're not in the field with them while they're doing the inspections or any of that. This is sort of, you come in afterwards and curate those things.
Yeah, from what I've been told by the health department is that, there are surprise inspections. If places knew they were coming, it would kind of defeat the purpose.
Totally.
Yeah.
What kind of follow-ups do you do to clear the businesses once they've corrected code violations?
Well, we are always giving them our contact information, asking for their comment on a failed inspection or a temporary closure. So they're allowed to tell us all of the updates after the fact.
Okay.
And we do follow up on the air. I mean, if a week later, if a restaurant gets a bad score, week 1, week 2, or week 3, but they correct it, we report on that. So that's sort of part of the formula too, making sure that the corrections are reported. But sometimes they don't correct, and sometimes they stay closed, and we mention that too. Mm-hmm. So there are a lot of moving parts.
Mm-hmm.
How do you help your audience understand and make sense of the gradings and violations? You hear cockroaches or no soap in the building, those kind of speak for themselves. But then something like use of a glove in certain situations or refrigerator temperatures might leave someone wondering how egregious that is. How do you do sense making for your audience?
Well, a low score is always going to be a place that fails their inspection or is temporarily closed. And the health department does that based on a point system, right? So high scores are going to be places with 2 or less violations. And so by that standard, we are basically going off of the lowest scoring restaurants in terms of who has a number of different violations, and we make that well known, the number of violations.
Okay. Do you feel like is there a time where you ever need to clarify something that you think is even vague in the wording or in the, sometimes things are jargony to health inspectors that may not make sense to an average person who's listening, but do you find yourself being like, oh, and just to explain, this is why this, or this is why that? Or...
Yeah, I think that's the best part about the whole segment is that when people go out to eat, they're not necessarily like, let me look at the county health department recent inspections and see where I should go. So what we do is we take that jargon and the technical terms and we turn it into conversational speak and make it more digestible, pun intended.
Digestible. Good.
I'm speaking as a food critic myself who sometimes writes a negative review of a restaurant, so I do understand the nature of, I guess we'll call it confrontational journalism for just the moment. But do you have any difficulty getting face-to-face with restaurateurs and talking through those reviews?
Yeah, sometimes. Sometimes we go there and it's just a regular employee, a crew worker. And so I give them my information and I tell the manager to reach out. If we go to a place that's temporarily closed, I'll look up contact information however I can. We'll take every avenue possible to get in touch with them.
But I think, if I could just jump in real quick, I think what works really well for us is, and we've had this happen many times, is when the owner or the manager comes out and collaborates. I'll give you a very specific example. Paravinci's had a bad score and they failed their test one time. We went there and not only did they not, get out of here, throw us out, they welcomed us in, they showed us where they'd made the corrections, they took us back into the kitchen, and everything was fine. And I think that was sort of, in my view, how the segment optimally would work.
Okay.
Amy's Donuts is another good one. They showed us how they were fixing the tile on the ground. They actually had a contractor there doing it when we went to go confront them. And then they also showed us that the hand washing sink was working again. So
yeah, do they ever flat out engage do they ever just flat out refuse to engage with you sometimes?
That's only happened to me. Well, I don't know if I would say refuse to engage, but it's only happened to me one time where there was actually a manager there, but they didn't really want to discuss.
Okay. Do you find them generally forthcoming and wanting to tell their side of the story?
Mm-hmm.
Okay.
I think so. I think some of it doesn't happen in the moment. As Julia mentioned, if we get maybe just a worker who's not a manager, we get kind of referred with an email or a phone call. But I think for the most part, in almost every report we've heard from the restaurant, I think there's only been a few instances where it's just, please get out of here, and we don't really hear their side.
Okay. Is there any concern that the extra coverage and attention on the bad health ratings possibly inflates them to become more harmful to the business?
I think the way that we balance that, right, is we always follow up, so we're fair, but we also, in our report, and I know a lot of the focus on our Restaurant Roundup report are the restaurants that fail, but every report we highlight the restaurants with high scores, and then we even kind of go a step further, and Julia will interview restaurants that are high scoring to talk about what makes them unique and what they're known for. So that's just one way we really balance, because we recognize going to a business to talk about a failed health inspection could be harmful, but we also want to recognize the businesses that are excelling when it comes to health inspections.
But it's an interesting thing, and this is sort of a journalism thing too. If you look at the segment, more than half the segment is usually a positive story. And these guys got a great health score. They make terrific burrito. Whatever it is. Nobody wants to talk about that part. They just want to talk about the part where, you said they got a bad health score, and that's going to damage the industry. Well, we don't believe that's the case. We think it's actually helping the industry, because everybody should be held to the highest standard possible. And I think we're here collaboratively with the restaurant industry to talk about what they're doing, celebrating the good stuff, but also saying if there are people who need to do some work, we're here to point that out.
Yeah. We've gotten an overwhelming amount of positive support, and there's always going to be a few haters, but hearing just from chefs out at the restaurants, they've been telling me, this holds people accountable. like I said before, people aren't necessarily looking at the health inspection website. So when a restaurant does poorly on a health inspection, there's not a lot of incentive for them to do better. But now we're kind of holding them accountable, and it seems like places are turning around just because of this.
Yeah, from a journalism perspective, I'd find Restaurant Roundup's footing defensible in that you're working from publicly available documents that you didn't create or influence. Sort of that follow-up is, do you worry that those health ratings are ever missing any part of the story, though? Or is that your job to go find that part when you want to?
I think that's when we go in there and try to be nice. I don't try to be too aggressive. They're regular people. They're not murderers. They're not. We have a lot of stories where we do have to be aggressive, right? But I think talking to them like they're humans and trying to get their side is the way to go with this.
Well, and we've sat down and eaten a lot of these. We live here in this
Yeah.
town. I mean, it's not that we're not in New York City, so it's easy to go and find these places and go in afterward and go in before. So this is all we're part of the same fabric of the community. So we care. I want my restaurant to be clean. And again, back to your other point, you're not going to get your restaurant closed because somebody has their hair not on improperly. Those tend to be egregious violations. Mold and, like you said, rats and things that really, when they hit that scale, I think that's when it's worthy of being reported on.
Yeah, one example I got from a chef that I wanted to run by you in terms of maybe a missing part of a story. So he was telling me that he was forced to throw out the entire walk-in of food because it was 1 degree below temperature when health department came. But health department came, it's their secret, it's the surprise visit, right in the middle of their rush. And so the cooks were constantly opening that door back and forth, grabbing prep items. So he felt like that was sort of a nuance they weren't accounting for, that they were just going on the black and white. Here's what a thermometer says. Well, here's the moment you hit me at the rush, guys. Like, what's going on here? How would you handle that information if you were presented that, and how would you report on that?
That's a very interesting scenario that I haven't seen since I've started reporting on this segment. What I've seen is those temperatures are way off from where they should be and deep into the temperature danger zone. Those are the ones that I'm going to report on.
Mm-hmm. So that you might see something like that, and that might be one you just wouldn't choose to report on that week. It's not very interesting. You're like, 1 degree, not worried about that one.
Well,
If I saw that,
yeah, but on the other hand, you bring up an interesting question because maybe we would say, again, it's not every week is exactly about pounding away on the health scores. That might be to say, here's one that failed but 1 degree. Health department, explain to us, is there a gray area? Do you have a margin for error? I hadn't even thought of that. So if your chef would like to call us, we'll do that story, wouldn't we?
Yeah, I think that's interesting perspective that we're looking for when we do go and talk to these restaurants, stuff like that maybe the average person doesn't really think about and understand if they don't work in the food industry.
But help, again, if the restaurant community, wants to get stories out, we're here to talk about it. Help us find those stories. So if someone were to come to us and say, I'm sure we didn't do that as a Restaurant Roundup, as I recall, did we?
That doesn't
The 1
ring a
degree
bell.
off guy?
Was that in a report?
No.
Okay.
That was.
It was just anecdotal.
Yeah, I in fact, I'll come over to these before we conclude. But I reached out to a few chefs because people will message me like, "Hey, have you seen that Restaurant Roundup this week?" They're all angry about it, and I'm like, "Well, what do you want me to ask these guys when I interview them?" So I asked the chefs to help me get some questions together for you from them. So
So we would take that question to the health department and say, in the middle of a rush, the door's opening and closing, is there any grace for that, or is this a strict black and white? Those kind of questions that we'd love to ask. We just don't know to ask them.
yeah.
yeah.
Have you had any others defend their ratings in a similar way, or some other story that is an example that stands out for you, where you're like, that taught us something that week. We learned something new here.
Not on the top of mind, but I would say these are the type of conversations we're having with the managers and with the owners when they talk to us, and that's why it's so important for us to go and try our best to get in contact with them, because there could be discrepancies like that. Our concern is food safety, right? And I think that came out very clearly when we were talking to the health department about the backlog of food truck inspections. I don't know if you saw that one in the follow-up.
Yeah, can you?
Yeah, please.
Yeah.
Yeah, tell us a little about it real quick.
So this whole segment is about food safety, right? It's not necessarily about coming after certain restaurants that are low scoring, and that food safety sometimes, like you said, falls in the hands of the inspectors and what they're doing. And we found that there was a massive backlog of food truck inspections. Places were 1-2 years overdue on inspection. We got those public records from the health department. We talked to them about it. A month later, we go back to look, there's a substantially lower amount of food trucks that are overdue on
They
inspection.
miraculously caught up. Go figure.
Oh, okay. So they
They
took
said it
you
wasn't
seriously.
because of us,
No,
but
just-
Oh, of course not. Of course not.
Makes sense, yeah.
Well, that's interesting. So you ended up finding sort of a side story there and reporting on the agency that's
Yeah.
doing the reporting that feeds your stories. So, okay. So I did a poll on my Side Dish newsletter earlier this year when I was writing about Restaurant Roundup, just letting people know that it debuted. This is back in like February or March. And I asked my readers in a quick poll, are you likely to give a chance to a place that receives a poor health grading? 3% said yes, 24% said no, and 73% said depends on how bad the rating. And do you feel like allowing them to tell their side of the story actually makes Restaurant Roundup a good thing for them? You said that earlier, Steve. And that shy of that, the public might just see ratings and avoid spots without giving them a chance to explain themselves.
People are looking for, they just want somebody to be accountable. And I think a lot of people are forgiving when you explain yourself and you take responsibility. And so that's a big part of why we give restaurants a chance to respond without just, we don't just report that they failed and leave it at that. So I think people are more likely to be forgiving and give a second chance when they hear from the restaurant on explaining why something may have happened.
And I think there are always going to be a group of people who just don't want us to report on this at all. And the fact is, it's not our data, it's third-party data from the government, effectively, from the county and city government. And what we try to do is take that and provide context. Yeah, it's a low score, but okay, we can explain why. Well, because we had a problem, but we've got the vendor in to fix, and there are a lot of these things again, we've all got some restaurant experience, albeit a long time ago, are explainable. And our people will say, well, I understand, because, sometimes our grill goes out, whatever the issue is. So, we're trying to put some information, some context behind those numbers, but we're going to report on them, and we're not going to apologize for what we believe is doing our job. And just to another point, we're also not going to apologize for making interesting content.
I'm going to interject with a question. Have you guys had any feedback from the public health department about this? We've talked about the chefs, and I think Matt's going to get into the viewers and the public, but have you heard any positive, negative feedback from El Paso County Health, whether you're overstepping what they're doing or anything like that?
positive feedback. Yeah, and when I did the sit down about the food trucks, they were thanking us, which I thought that was interesting, right? Because I thought they'd be a little defensive
Yeah.
once we started asking them questions about their procedures, but they started out the entire conversation thanking us for the segment, saying that it's holding people accountable and creating change.
What feedback have you gotten from the viewers and public otherwise? And since between January and now, has any of that feedback shifted your reporting style or approach? Anything kind of like lessons learned that might have changed?
So this is undoubtedly probably one of the most popular things that we do here. And it's not just sort of anecdotal that we're saying that. We have digital metrics to back up the interest from our viewers and our readers. The digital metrics are off the charts for website, social media engagement. We do mobile push alerts on these so we can see how many people open an alert to get to the reporting. So we know it's resonating with people. We often will get a lot of emails from people too about the segment.
Just to touch a little bit more on the digital metrics, tens of thousands of clicks per article, and one of our Restaurant Roundup articles from recent months was our highest viewed article of the entire year on our website. So just goes to show how popular it is. I think anything great never had zero pushback, never had zero haters, right? So there's always going to be a few, but overwhelming positive support for sure.
Yeah, if it's okay with you, those chefs again sent me questions.
Sure.
So, borrowing the word haters, can I read you a few hater comments and then just open-ended anything you have to say, or you can just nod your head and smile and we'll accept that too. I asked them, what would you like me to ask on your behalf? First response was, the information is public for anyone who cares. Why do you need to use a megaphone to drive people out of business? These are loaded questions. I wouldn't write this question as a journalist. There's some emotion in there, but that was perception, I guess. But
I think it just goes back to this is a public service that we do, and yes, they are publicly available, but it's not practical for people to go to the El Paso County Health website to sift through hundreds of pages of reports, and that's part of our job as journalists, is to make that process simpler and to get information out there And that's sort of the fabric of what we do here, whether it's Restaurant Roundup or our daily news reporting.
All right, hater number 2. It's just sensational journalism trying to get a story masquerading as public help.
Again, we are not going to apologize for doing stories that people want to watch. It's not sensationalism is probably, it's one of those kind of tropes that people throw out. I think it's from the 80s. So, tell them to please, kind of get into the current, mindset. We are not sensationalists. We are telling good stories, and we're not going to say we're sorry for that.
I think I just want to add to that too. I think the confrontation, right? When we show Julia going to the restaurants is probably what people might be referring to when we say sensational. But as journalists, it's important that we show our viewers that we are making an effort to get the other side of the story, right? Because we could say we did, but it's not the same as when you see our reporter go there and say, okay, she did give them a chance to respond and they didn't.
And I'm sorry, I got to just jump into
Yeah.
the word confrontation. I think is misleading because there's not much confrontation. There's usually Julia walking through the door, and they either talk to her or not, and more often than not, they say, "Well, we've done it. Come on back." So these are not like where the security force is throwing us to the streets. So the interaction that we have is more often than not very positive with most restaurant people.
Confrontation is kind of an industry term that we use.
But yeah, it's not. It doesn't mean we're going to confront.
Sure.
Oh gosh, what was I going to say? I would implore that person to look at the health inspections and then look at our reports and put them side by side because they're nearly identical when it comes to what we're saying. All we're doing is turning it into regular people speak.
Okay. I've got one more if you want it. If not, you've said
No.
Okay.
All
All right. Last hater comment from Chef. In light of the suffering of thousands of restaurant owners and employees, with the incredible difficulty of operating in the local restaurant space and the drama of the last few years taking out large quantities of restaurants, how do you justify adding another layer of pressure and possible damage to these struggling local businesses? Doesn't that seem irresponsible or at least tone deaf?
Well, we're not adding any pressure. The health department is. We're simply reporting what the health department is doing. I mean, again, I appreciate that, but I think it's misguided. I think if there's an issue, perhaps they should talk to the health department about if they don't like the grades or maybe the grades need to be updated. I don't know. But, us reporting on public information is certainly not, I can't remember all that stuff, but all the gloom and doom you just said. I just think it's fair, balanced journalism. And we are not in the business. We don't take sides. Clean up, everything will be fine. Really. I mean, I know it's not that simple, but essentially we're taking information that's given to us by somebody else, reporting on it, and giving people an opportunity to explain. I don't know what else we should be doing.
I wonder if they would be so angry if the segment wasn't so popular. But it's popular because people care.
People care.
I can invite them on if you want. No, well,
Yeah.
I'll put you in touch. No, thank you very much for making time for me today, for answering all these questions, and for the work you're doing with Restaurant Roundup.
Yeah, well, thank you. Great questions.
Yeah.